Well, good morning, everyone. Happy Wednesday. I want to thank you for taking your time out of your day to come and join us for Fidelis's national webinar series. And for February, uh, we are going to be talking D-SNP and C-SNP. And for this one, we have actually partnered up with UHC, one of Fidelis's premier carriers nationwide. And one of our favorite folks with UHC is George Marquez. And if you can believe it or not, he is more handsome in person than he is in that picture. But I know it might not seem possible. But anyway, we're going to give him some time to talk about it. There will be question and answers at the end of it. If you have any questions, you can put it in the chat box. We will be monitoring that. Right now, you just have a coverage map here. My name's Brad. I'm one of the regional sales directors for Fidelis. We also have Carrie DeVore. She's the other regional sales director. Marisa Canold, who's a sales director up in Colorado, and Nick Santmeyer. He's out on the east in the Virginias, Carolinas, all that good stuff over there. So we're all here to provide you any support. So if you have any more questions at the end of this, if you'd like to know a little bit more about Fidelis, what makes us different, how we can help you grow your business, you need to get in touch with your local UHC rep. We would love to help you out with that. So there's a minute. You can take down our emails, phone numbers, and we'll go. And with that, let's kick it over to George.
Awesome, Brad. All right, so let me share my screen here. And Brad, will you let me know if you can see my screen?
I see it.
Perfect. Okay, awesome. Well, good morning, everyone. Excited to be here and appreciate the opportunity that Fidelis has extended UnitedHealthcare to talk a little bit about our C-SNP and D-SNP products in the market or kind of across the country. Once again, my name is George Marquez. I'm the Market Director of Growth, and I oversee New Mexico and Southern Arizona. And so for today's presentation, we're gonna dive into a little bit of our dual special needs plans, but we're gonna spend the majority of time talking and actually walking through our C-SNP, since that's relatively new in a lot of markets, but also a big selling opportunity as we kind of wrap up OEP and we head into SEP. All right, so jumping into one of the big subjects concerning dual is and some of the new rules around dual eligible membership, which has been top of mind in a lot of conversations. Um, around the industry as CMS's rule changes really focus on advancing Medicare and Medicaid integration. So, kind of in simple terms, integration means that the state and federal governments are working together so that members only have one plan from the same carrier. So, the new rule that went into effect on January 1st of this year creates a new integrated care SEP, which only allows full dual eligibles to enroll into an aligned and integrated plan during SEP. That would ensure that their Medicare and Medicaid is provided by the same managed care organization or MCO. You'll hear that term thrown around, or both are kind of fancy ways to say the same company. And so this election period allows them to make a change, or you can utilize this election period every month. And so again, it allows them to go into a aligned and integrated plan, or they can go back to original Medicare and a PDP. And so essentially what we were used to was the dual LIS maintaining election period, which allowed last year folks to change their coverage once per quarter is no longer available, and they've shifted to this new integrated care SEP. So we've been getting a lot of questions around this integrated care SEP. And again, you can use it. It's available every month, but again, only to go into an aligned and integrated plan or back to original Medicare in a PDP. It also allows any dual eligible as well as LIS individuals to join or enroll back into Medicare fee for service and a PDP. So it's important to note that those folks, those QMB onlys, those partial dual eligibles, and those individuals with LIS do not qualify for the integrated care SEP to enroll into a plan. Again, they can only go back to original Medicare and a PDP. And so what you'll need to do is you'll need to look at other, what we call special circumstance SEPs to see if another election period is available. And so, or really kind of in general, another election period is available. So kind of as a reminder, AEP and MA OEP rules still apply. And again, during AEP, members can go from traditional Medicare to MA or from MA to MA. And then during MA OEP, members can go from MA to MA. So here is some examples of other special circumstance SEPs that could be available. So these could be like they're losing coverage from an employer. They recently moved outside of their service area for their current plan. In some states, if there's long-term care or all-tax, like in the state of Arizona, we have all-tax Medicaid. They move in and out of long-term care facility. There's a 5-star Medicare Advantage only plan. These are all different election periods that that could be used to enroll those folks that have QMB, SLMB, QI levels of Medicaid into an appropriate plan. And so one of the best resources that UnitedHealthcare actually offers, and when I was a market manager, I used to kind of call it the agent's best friend, is the election period book. And you can find that if you log into Jarvis, go over to Knowledge Center, go to the Learning Lab, and just type in election periods. And then if you click on additional resources, you'll find the PDF version of that booklet, but it basically details out every single valid election period that CMS has. And it even gives you examples of scenarios in which you can apply those election periods. Also, I know in a lot of markets right now, our local teams are doing a lot of election period trainings. As you know, we're all having to make this adjustment, and we're kind of used to being able to sell year round with a very specific election period. But I would definitely encourage you all to, one, either attend our national election period training, attend your local market election period training, or read through that election period booklet. It is one of the pieces that I download and save on my computer. And so when agents call me, or even when my team calls me to ask me a question about election period, it's the document and the resource that I utilize as well to help navigate and educate myself on an election period. So again, go to Jarvis, go to Knowledge Center, go into the Learning Lab. In the search box, just type in election periods. And then once you find that training module, click on it and click on additional resources, and you'll find that the PDF version of that booklet. Another really great tool that really helps with dual eligibles, especially with the changes in the integration SEP, is our Medicare and Medicaid eligibility lookup tool. And so this allows you to determine Medicare and Medicaid eligibility for consumers and members with increased ease and convenience. The Medicaid search also provide a list of plans available for that individual for enrollment. When you log into Jarvis, it's one of the tools that's right there on your home screen. So when you go to the Medicaid eligibility tab at the top of the tool, you'll want to complete all the required information, which are the boxes indicated with a red asterisk, and then you'll click on the Check Medicaid Eligibility button. Now, once the Medicaid eligibility has been clicked, the Medicaid eligibility results will display like what you're seeing on the screen right now. And it will display if the consumer is eligible, yes or no, the plans that they can enroll in, and the consumer's Medicaid level. You can also launch a application directly from this tool. One recent enhancement that we've made too is for those states that have integrated dual special needs plans in the market. And if you're not sure if you're in a market with an integrated D-SNP plan, just reach out to your local UHC rep and they'll be able to educate you around that. But one enhancement that we recently made is it will actually indicate if they do not have UnitedHealthcare as their MCO, it will tell you that for those integrated care, or excuse me, integrated dual special needs plans. So another really great resource when it comes to helping D-SNP members with their Medicaid recertification or reapplication that they have to conduct annually is our Social and Government Referrals Program. And so how many of you actually have heard of this program with UnitedHealthcare? And feel free to put it in the chat box. So a couple of you are aware of it. This is perhaps probably one of the best tools that are resources that United Healthcare offers. So with the Social and Government Referrals Program, they can assist, like I mentioned, United Healthcare Medicare members apply for really a wide variety of programs that may help them address their financial and or social needs. We are when we have this program, or part of the kind of the concept of the program is we really are considering the whole person. We're not just looking at medical care, but we're this program is really meant to help remove barriers that kind of limit access to care, as well as address health disparities and help improve kind of the overall health and well-being of members in this vulnerable population. And so the Social and Government Referrals Program is available to United Healthcare Medicare Advantage members, and it really they get more for their Medicare dollar, and by helping them by helping members connect with resources that they may be eligible for, such as access to food, housing, transportation, financial stability. This program isn't limited to members. We can also help pre-effective consumers too. So the SGRP can assist pre-effective United Healthcare consumers with things like low-income subsidy, the Medicare Savings Program, and social assistance and referrals. It's really a simple two-step process to screen and kind of complete a warm transfer. So if you'd like to learn more or you'd like to leverage this with some of your members, you can check out the Social and Government Referral Program Job Aid, which again, located on Jarvis. So you go log in Jarvis, go to the Knowledge Center, click on the Learning Lab. Once you're in the Learning Lab, you can search Social and Government Referrals Program, and then you'll see a training module there. There's job aids there. There's even a little training on the overall program. But it's definitely something that I would make sure that you kind of utilize when working with this population. You can also find a flyer in on Jarvis that you can share with members. So that pathway is Jarvis Knowledge Center, click on member experience, then click on the D-SNP tab, and then you'll see a redetermination communications to share with members, and that's where the SGRP flyer is for consumers. So with that, we are going ahead and transition into talking about chronic special needs plans. And again, this is where we're going to spend a majority of our time today. So in the section of C-SNP, we're going to cover C-SNP features, talk about sales opportunities, enrollment. We're going to kind of walk through the verification process. We're going to talk a little bit about some resources that are available. And then at the end, there'll be a call to action for all of you. All right, so let's get into the basics of chronic special needs plans. So, chronic special needs plans are a specialized Medicare Advantage plan that um, that means its benefits are really designed for people with healthcare with special healthcare needs. So the plan is designed to provide additional benefits that specifically apply to folks that have diabetes, chronic heart failure, and or cardiovascular disorders. And the plans include providers who specialize in treating these conditions, and health programs are designed to serve the specialized needs of people with these conditions. And so, in addition, the plan covers prescription drugs to treat most medical conditions, including the drugs that are usually used to treat diabetes, chronic heart failure, and or cardiovascular disorders. So when we look at eligibility, to kind of be eligible, consumers must uh, have an eligible chronic condition, have both Medicare Part A and Medicare Part B, live in the service area, and are a United States citizen or are lawfully present in the United States. When it comes to provider network, just like any Medicare Advantage enrollment, you want to make sure to select an in-network PCP for the best coordination of care. People with chronic conditions tend to utilize one or more specialists to manage their complex health conditions. When it comes to benefits, C-SNP plans have benefits and services that are, again, tailored to these individuals who are managing these chronic conditions. And they are specifically designed for those managing one or more chronic conditions. C-SNP plans include care management, which includes clinical management programs, primary prevention, and health education. These C-SNP plans also offer low-cost insulin, so $25 copay or less, and specialist copays, access to routine foot care, and many plans also cover transportation as well as healthy food and an OTC benefit. So, kind of when we look at the enrollment opportunity, most consumers who are not already enrolled in a C-SNP plan for their chronic condition can enroll anytime during the year based on qualifying conditions. Now, note something to note: if a member loses their eligibility, but can reasonably be expected to regain eligibility within 6 months, they are still eligible for membership into a plan. As we continue throughout today's training, we will be focusing kind of on these areas and um, and kind of walking through those different aspects. Now, the opportunity to help people live healthier lives is here. You'll probably be having you probably know that having a chronic condition or disease means to have an illness that is persisting for a long time or consistently reoccurring. Now, consumers with chronic conditions or diseases may be overwhelmed with their medical costs and have trouble managing multiple providers and need guidance to navigate the health system. So, what percentage of Medicare beneficiaries in the United States manage a chronic condition? It's actually 50% of UnitedHealthcare Medicare Advantage members manage at least one chronic condition. And this statistic means that there's a lot of potential consumers out there. Now, diabetes is a very common chronic condition. And as you probably know, type 1 and type 2 are both qualifying conditions for our chronic special needs plans. But what's the difference between the two? Well, type 1 diabetes tends to develop suddenly and can escalate from mild to severe in a matter of weeks. Type 1 diabetes is more likely to be diagnosed in childhood or adolescence, which is why it is used, it kind of used to be called juvenile diabetes. Now, type 2 diabetes develops gradually and sometimes over many years, and people with type 2 diabetes may not know that they have the disease until it's fairly advanced. Although type 2 diabetes can develop at any age, it is most often actually diagnosed later in adulthood. And about 95% of people with diabetes have type 2, while around about 5% have type 1. Now, within the UnitedHealthcare C-SNP portfolio, there's actually three different types of C-SNP plans across the country. Um, there are plans that are designed for, there are three plan designs for these C-SNPs. First, there's standard, then there's extra help, and then there's dual eligible. They are all kind of designed to meet the needs of members with diabetes, heart failure, or cardiovascular disease. And the standard C-SNP plans can be identified by complete care in the plan name. And then the dual eligible and the extra help C-SNP names utilize the term complete care support. Now, when it comes to standard C-SNPs that are designed, or kind of the makeup of these plans, they are designed very similar to the non-SNP plans, although with richer plan offerings, which we'll kind of cover here in a moment. And some of those kind of richer plan offerings are $0 premiums with cost sharing designed to help members pay less out of pocket, especially compared to non-SNP plans. They'll have richer ancillary benefits compared to a non-SNP, and typically include healthy food and an OTC benefit. C-SNP plans also, or the standard plans also offer access to broad local network of providers, with some plans also offering a national network. And then again, in kind of when you're looking at plans or a C-SNP plan in your area, these standard C-SNP plans can be identified again with that complete care term in the name of the plan. So what you're seeing on the screen here is a kind of up in the right-hand corner, a map of where we offer standard C-SNP plan designs. And it also, the very last bullet point there on the screen also lists out the states that these are available in. The dark blue means that we renewed a C-SNP plan, so we've already kind of been offering a C-SNP in those markets. The kind of light blue is expansion of C-SNP plans into those markets for 2025. And then the orange is we exited a C-SNP plan. Now, when it comes to C-SNP plans for dual eligibles, these plans are designed for consumers with one of those three qualifying chronic conditions, and they also have full Medicaid, although they do not technically require Medicaid to enroll. So really kind of anyone can enroll into these plans, but it's best if they have full Medicaid. It's really not appropriate for individuals without Medicaid because of the high cost share on the medical side of the plans. So again, these are specifically designed for those consumers with qualifying chronic conditions and full Medicaid. The plan is intentionally designed for medical costs to be covered in full by a member's Medicaid, and the RX copays to be covered by extra help. Like a D-SNP, these plans have richer ancillary benefits compared to a non-SNP. And again, when you're looking at your market or when you're looking at these plans, what you'll see is the complete care support term in the name of the plan. Now, once again, the map up in the right-hand corner is going to show you where we offer these C-SNP, D-SNP plans, for lack of a better term. And so the dark blue is our markets that we already offered, and we renewed those plans for 2025. The light blue again is expansion and new plan offerings in 2025. And then the orange are markets that we no longer offer C-SNP plans for 2025. Again, the last bullet there will list out the states that these plans are available in. Now, something new for this year are what we're calling extra help slash kind of LIS C-SNPs. And these plans are designed for consumers who have one of those three chronic conditions and low income subsidy that help pay for their prescription, which allows more benefit dollars to go towards lower medical care and ancillary plans. So these plans are only available in select markets listed on the slide here and are set up as a side-by-side plan to a standard C-SNP in these markets. And so what you'll see is this again was brand new for 2025. So all that light blue area are markets that we launched these plans in for this year. Now, there are several key features in C-SNP plans. So C-SNP plans will offer similar access to $0 premiums, $0 PCP, and $0 Tier 1 copays as kind of our non-SNP plans offer. But they'll have lower costs on average for specialist copays, RX deductibles, Tier 2 retail copays, insulin copays, as well as diabetic supplies. So kind of in addition to lower costs, most of our C-SNP plans also offer more of the most valued extras, including a monthly credit to buy healthy food and over-the-counter health and wellness products, which is a combined benefit not available on our non-SNP products. Plus, they have access to a unique formulary with commonly used prescriptions to cover or commonly used prescriptions covered on a lower Tier 1 or Tier 2, which also means they won't be impacted by a deductible for plans that have a prescription deductible. Members will need a provider who can verify that they have one of the three chronic conditions, and UnitedHealthcare helps manage this process, which we'll actually walk through that process here shortly. And then for all the details, you can attend one of our national webinars or check out our quick reference guides on Jarvis to learn more about some of the key features and differences of our C-SNP plans. Now, one aspect of our C-SNP plans is the care management model, which aims to identify high-risk members, assess treatment options, coordinate care, and design treatment programs for members to get the customized type of care that they actually need. So most C-SNP plans have a UnitedHealthcare house calls in-home visit as well. And so this service helps members stay up to date on their health by way of an annual in-home visit by a healthcare practitioner. And so just note, depending on where you are, house calls may not be available in your area. So you should talk to your local UnitedHealthcare representative. Now, as I mentioned, many of our C-SNP plans offer a over-the-counter and healthy food benefit, and we all know that inflation continues to kind of affect the price of food. So, when we were looking at 2025, we wanted to continue to offer this combined OTC and healthy food benefit to many of our chronic special needs plans. So as a reminder, members have access to shop in store, online through their member website. Kind of most plans across the country will have $55 or more in credits each month for this benefit. And so if members are not aware of this benefit, or you want to look at a C-SNP plan specifically in your area and see what this credit is, the Medicare product portal is a great place to look at that. All members have to do is utilize their UnitedHealthcare U card, and if they're in store, they just swipe it with the new magnetic strip on the back, or they can log into their member website and place an online order for their healthy food or over-the-counter products. Now, C-SNP members will benefit from the additional formulary enhancements that non-SNP members don't have access to. So the Inflation Reduction Act, which went into effect on January 1st of 2023, lowered the cost of insulin for all members with a Part D benefit to pay no more than $35 a month through all coverage stages, except the catastrophic payment stage where the member pays zero. All standard C-SNP members will have access to an even lower $25 or less cost share for a 1 month supply of covered insulin drugs through all drug stages except for the catastrophic drug payment stage, where again the member actually pays zero. Mail and retail 3 month copay multipliers are consistent with other tier 3 drugs on the plan. Also, C-SNP members can get diabetic supplies covered on tier 2 on C-SNPs versus tier 3 on non-SNPs. And because they are covered on tier 2, they are $0 copays through home delivery, since home delivery is $0 for tier 1 and tier 2 for covered drugs. So make sure to share with your members taking insulin medications the savings that they could be seeing by enrolling onto a C-SNP plan, or if they're already on a plan. Now on this slide, this is kind of show you a breakdown of what C-SNP drug coverage and whether something is covered by Part B or Part D, which is a lot of folks get confused on. And so there on the right-hand side, you can see a list of some of the drugs and medical supplies that folks with diabetes use. So things like glucose monitors, continuous glucose monitors, blood sugar test strips, Lancet devices, those are all going to be covered by Part B as in boy. Things like disposable insulin pumps, alcohol swabs, gauze, injection devices, insulin pens, insulin syringes or needles, those are all covered by Part D. Now, one thing that I do want to call out, which actually gets overlooked a lot, and it's not just applicable to our C-SNP plans, but it's also available to folks on our D-SNP and C-SNP plans, is specific to continuous glucose monitors. UnitedHealthcare actually covers continuous glucose monitors at a $0 copay for the actual monitor. But in addition to that, members will pay a $0 copay for their monthly sensors. So every month they have to replace the sensor on their arm, and those are also covered at a $0 copay. Most of our competitors have a copay to replace those sensors, and those copays range from anywhere, I would say, about $50 to about $70 every month. And so that's a kind of one of those benefits of our non-SNP as well as our C-SNP plans that sometimes agents or even members don't realize they have access to. And so if you have folks that are diabetic, definitely want to educate them on that, because that savings can range from $600 to $840 annually by not having to pay for those sensors. I'm also going to put a little plug in here for Advanced Diabetes Supply. They work seamlessly with us to help our members who have diabetes. and get their supplies, and they're very familiar with, our coverage and whatnot. So they're a great organization that if you have someone that wants to receive diabetic supplies via the mail, you can refer them over to them, and they'll take care of them. They're a great organization to work with. All right. On this slide, this just kind of gives you an idea of some of the drugs that individuals with chronic conditions, specifically around cardiovascular diseases and chronic heart failure, take, and what their tier is on a C-SNP plan versus on a non-SNP plan. So what you'll see is many of them are, on C-SNP plans, they're going to be tier 1 or tier 2 drugs. And then on non-SNP plans, they tend to range from tier 2 to tier 3 drugs. And so I'll give you all a second to kind of look through that list, and then we'll kind of proceed with the next slide. So let's go ahead and dig a little bit deeper into that care management model that I mentioned before. So, um, you know, as we kind of mentioned before, the results of the health assessment will determine a member's risk level, as well as the additional care management support that they can receive. And so the care management model offers great resources for our C-SNP members who have been identified by their risk level for this extra service. And so these programs are available to all members with eligible conditions and risk levels, just not on and not just on our C-SNP plans. So the first one we'll talk about is the ESRD program, which includes chronic kidney disease and ESRD care planning, which offers member education, interventions, and specialty referrals as needed. High risk, another program is also the high risk diabetes program, which includes it's basically a testing program to help members identify early signs of disease. There's also the advanced illness program, and this provides comprehensive care for members facing life-limiting illnesses, generally defined as the last 5 months of life. There's also the transplant case management, which drives positive clinical outcomes by addressing the complex needs of members who are facing transplants. It also includes support from the first referral up until a year after the actual transplant. Now, let's go ahead and transition into the sales opportunity. So let's talk about the SEP election period that affect C-SNP eligible members. Members with qualifying chronic conditions not already enrolled into a C-SNP plan may qualify to enroll into a plan at any time during the year by exercising a SEP. So when you take an application, the code for your application is going to be SEP special needs / chronic. And the SEP can be used when consumers enroll into any C-SNP for the first time based on a specific qualifying condition. Enrollment using this SEP can occur at, again, any time during the year and ends once the consumer enrolls in the new C-SNP. When a member has a different condition that their current C-SNP does not cover and changes from their current C-SNP plan to another C-SNP plan that serves a different condition, enrollment using this SEP can occur again anytime during the year and ends once the consumer enrolls in the new C-SNP. Now, when a member is eligible for a different SEP, whether that be a change in residence outside of the current plan service area, the SEP can also be used. So let's kind of put this into action and look at a scenario together. So meet Patricia. Patricia has a chronic condition and is not enrolled in a C-SNP plan for that condition. She can exercise and utilize the SEP special needs slash chronic to enroll into a C-SNP plan. Now, finding and engaging C-SNP consumers starts with really building relationships in places where consumers with chronic conditions go, such as wellness centers, dialysis centers, nutrition centers, and fitness centers. Become visible and engaged to really earn their trust over time, which can lead to referrals as well as other opportunities not only for new members, but for existing members. In your yearly check-ins with your members, assess the needs of your current members to see if their health needs have changed and if a C-SNP might be a better fit for them. Also, here's a tip. Use the MA shopping sheet on the UnitedHealthcare toolkit to compare a non-SNP and a C-SNP plan in your market so that members can see the richer plan offerings. We also offer 3 national webinars that can help you dig deeper into these areas. And so these are the first one is Find and Engage Consumers. The next one is Grassroots Marketing. And then the third is Retention. Now, what are some statements that you can also listen for in your sales conversations to know if a consumer could be a good fit for a C-SNP plan? Well, one of them could be I take insulin for my high blood sugar. I need test strips. I have an endocrinologist. I have a cardiologist. I had a heart attack. I have poor circulation in my legs. I take Eliquis for an irregular heartbeat. These are all phrases that could trigger additional inquiries when you're at an appointment to your member or to a potential member that will help you identify if a C-SNP might be a potential fit. Now, talking a little bit about the enrollment process and verification forms. So before you can enroll a consumer into a C-SNP, you must get certified to sell the C-SNP products. There are 2 ways to become certified to sell C-SNPs. The first is pass the fast track assessment if you are eligible. The second way, which is shown on the screen, is once you have completed your basic level certifications, you must pass the D-SNP C-SNP assessment. Pass your D-SNP C-SNP assessment, and then you're ready to sell. If you don't know if you've taken this certification, you can actually go into Jarvis, click on your profile, and look at. If you click on certifications, it will show you what certifications you have completed. And if you don't see the D-SNP C-SNP assessment, then you'll want to log into the Learning Lab to take this assessment. Now, Jarvis Enroll is the preferred way to take enrollment. Applications are received and uploaded in our enrollment system within minutes. And Jarvis Enroll will also prevent common missed errors, which delay the enrollment process. So to select the C-SNP plan in Jarvis Enroll, you will need to choose the plan's effective date and choose the C-SNP plan listed in the plan's option. Now, something to note is you will not see the C-SNP plan options until you have certified to sell C-SNP products in your area. Then read the questions listed in Jarvis Enroll to the consumer. And once the plan is selected, you will need to choose the appropriate election period. As we learned before, there is an SEP for applicants who qualify for the SEP special needs slash chronic. And again, please reference the election period worksheet for specifics around election period qualifications. Now, once you move on to the next page, the chronic questionnaire will populate. You must read all the questions to the applicant and have the applicant answer. If they are unsure of an answer, there is no option to select not sure. There is also an authorization disclaimer found towards the bottom of the questionnaire, and this authorization allows the provider to be contacted by UnitedHealthcare to verify the conditions listed on the questionnaire. Fill in all the provider information for the applicant. Something that's very important is the provider listed on the verification form needs to be the provider who can verify the chronic condition. Sometimes we get folks that want to find a new cardiologist, and they'll list their current cardiologist, but they'll take the form over to their, the new one that they're wanting to work with after the enrollment, and this creates delays in the verification. So whatever provider is listed on the chronic verification form, that provider has to provide the verification. Now, let's kind of explore what is on Jarvis and Roll's C-SNP verification form. So what you'll see is there's several questions, and so consumers must say yes to at least one of the questions. When it comes to chronic heart failure, the consumer again must say at least yes to at least one question. And then for cardiovascular disorders, again, yes must be one of the answers for these questions. Now, in cases where your application needs to be submitted by paper, we'll go over some of the enrollment reminders now. So make sure you understand the eligibility requirements for the plan in which you're enrolling the consumer. Take time to fill out all the sections of the enrollment request form. Make sure that the name matches the Medicare card and that you have the right address. PO boxes are not accepted. You need to make sure the phone number is correct, date of birth, and the Medicare ID. If an email address is available, it's highly encouraged that you capture it. Be sure to select the method of payment and explain what is to be expected based on the selection made if the plan has a premium. If there's any errors, which can delay enrollment and potentially cause a denial, double check your work. That's one thing that we saw during AEP is we saw some errors because, I know y'all are busy, you're trying to get through the application and either fields were missed or the name didn't match the Medicare card, and it was just simple fixes. So just double check all your work. And then make sure you and the enrollee sign the application in all required areas. Now, for C-SNP, the chronic condition release of information form, as well as the chronic condition pre-assessment form, which is located in the enrollment guide, must be filled out and accompany the application. So it's recommended that you print off copies of the verification and consent to take with you. These forms will need to be filled out by the member and their provider. Another recommendation is confirm that you are faxing to the correct enrollment center. Use the fax number listed in the enrollment guide or refer to the paper application submission methods document prior to each new year. Faxing to the wrong enrollment center will delay enrollment and potentially lead to a denial of the enrollment. You can send paper applications by email for most UnitedHealthcare Medicare Advantage plans and all prescription drug plans using secured email. There are instructions for emailing paper applications in the enrollment handbook in Jarvis. And then before you enroll, utilize the enrollment checklist. In the ready to enroll section of the enrollment guide booklet to confirm the consumer understands the C-SNP. It can act as also a reminder of the specific consumer needs discussed during your meeting. The pre-assessment form and release of information must accompany the paper application, as I previously stated, and that's really, really important. So I wanted to make sure to kind of reiterate that as well. Now, when it comes to our C-SNP plans, we continue to offer payment for health assessment completions for our SNP, so both our dual and chronic plans. So for compensation details, you'll want to reach out to your local UnitedHealthcare sales leader or your upline. In most markets, it's $50, but there are some certain markets around the country where that can be a little higher. And so that's why I recommend reaching out to your local sales leader. Now, when you're working with chronic or when you're enrolling folks into chronic plans, one of your best friends will be the Jarvis Notification Center, which is the bell icon up in the right-hand corner of Jarvis, and it allows you to get notifications on chronic verifications. So when you log in, just click on the bell icon to read the member letter. We also want you to be aware that if attempts to confirm the eligibility of the member are unsuccessful. So we will notify you if we're having a challenge getting a verification done through that notification center. Now, talking about verification process, once the application is approved, the verification process will start. So let's review the steps, and kind of here are the steps that you've already taken at this point. So you've determined if the consumer has a qualifying condition. You ensure that the consumer has a provider who can verify the condition. The application was submitted via Jarvis Enroll. You completed the HA with the consumer, and you can check the enrollment status on Jarvis. Now, next, the member's application is approved and the verification process starts. Through the verification process, UnitedHealthcare will contact the provider that's listed on the verification form that was filled out in Jarvis Enroll. The UnitedHealthcare enrollment team may begin reaching out to the provider's office to verify the chronic condition prior to the plan's effective date. Once confirmed, the consumer stays enrolled into the plan. If there is missing information that is needed, the chronic verification team will attempt telephonic outreach efforts to the provider listed on the release. Note, when a member is already in a UnitedHealthcare C-SNP and they want to switch to another UnitedHealthcare C-SNP, we will not require an additional enrollment verification for the plan switch. Now, the plan has 60 days after the plan's effective date to verify eligible chronic condition. This is how verification is obtained. So after 30 days without verification, an initial letter is sent to the member if attempts to verify the condition with the listed provider are unsuccessful. Agents will also be notified via email and the notification center in Jarvis. If the member is not verified by the second of the month, they will get notified that they are going to fall off of the plan by the end of the month. The member could reach out to you with concerns. Now, if the verification is obtained, and I actually, before I kind of continue, something I want to make sure I reiterate is that United Healthcare will reach out consistently to get the verification done. One of the best practices that I've seen and that I encourage agents to do in the markets I oversee is to have the verification form either downloaded or printed out. And at the time of enrollment, since you're already looking up their doctors, I tell agents to call the provider's office, ask for an email address, and secure email the verification form over to them and really be proactive in that process. Typically, the agents who do that best practice hardly ever have issues with getting a verification done. Now, if the verification is obtained, the member will stay enrolled in the plan. The next steps that I'll talk about is if the C-SNP verification is not successful. So at the end of the second month, a final notice letter is sent to the members and an email to agents if attempts to confirm eligibility are unsuccessful. You will also be notified in the notification center in Jarvis. Again, United Healthcare makes multiple attempts with the provider listed on the verification form to complete eligibility verification. Now, if eligibility is not confirmed, the member is termed after the second month of enrollment. The member will return to original Medicare, and they will not be able to return, to their previous plan. Now, you do have an opportunity to help the member enroll into another plan. The member would be eligible to move to another plan using the SEP loss of SNP status election period. Now, remember, the verification process could take up to 2 months post effective date. All right, so kind of rounding out today's presentation, we're gonna talk a little bit about of the some potential consumers. So in this scenario, let's meet Sam. Sam lives at home with cardiovascular disorder. He is looking for a plan that is tailored to meet his needs. Agent Rebecca is meeting with Sam today to assess his needs and see if UnitedHealthcare could provide a plan for him. When Rebecca meets Samuel, they start discussing his current coverage. And so as we continue with this scenario, Rebecca asks Samuel if he has any chronic conditions. Samuel discloses to Rebecca that he has an irregular heartbeat and he was diagnosed with this disorder last year. So in this scenario, Rebecca knows that cardiovascular disorders are an eligible requirement for our C-SNP plans. So she starts discussing the opportunity to enroll into the C-SNP plan. Now I'm going to go ahead and skip this example just for time purposes, because I know we're coming up and I got a couple more sections. So I just want to kind of share some resources with you. So, United Healthcare really is committed to your success as an agent, and we've created a lot of great resources to support you, and we provide a lot of tools to support you. And so, one of the best tools that we have access to is Jarvis Enroll, which is designed to greatly expedite the C-SNP application. We also have the Medicare product portal, which gives you a better way to find, compare, and share plans. Once you sign into Jarvis, just select the Medicare product portal tile from the homepage, and you can personalize your location for quick links to plan support or local contact information. You can also custom build service areas and plan materials to present and share with others. There's also the Learning Lab, which has a lot of information regarding our C-SNP plans. That's where the election period booklet is located. It's more of our educational hub. When you're looking at utilizing Jarvis and really trying to verify doctors as well as look at prescription drug costs, Find a Doctor and the Drug Cost Estimator are two really great tools as well. We also have Jarvis, and in the Knowledge Center, we have these reference guides that are phenomenal. I use them on a regular basis when I get some questions, so I'd encourage you to spend some time taking a look at those resources. We also have the Agent Toolkit. This is where you can find all the marketing materials needed. This is also where you'll find one of the flyers for the Social and Government Referrals Program. There's a ton of different marketing pieces that are CMS approved for our C-SNP products. So just search C-SNP and in the search box there at the top, and it will show you all the marketing pieces that are available. And so, kind of some next steps, just make sure you get certified to sell C-SNPs. It's a huge opportunity going into SEP. Work with your local UnitedHealthcare team to strategize around this opportunity, identify sales pursuit strategies or things that you can do to drive referrals and enrollment. You can also spend some time learning about your market's demographic as well as the products that are available in those areas. And then I would spend some time exploring Jarvis and the Learning Lab for selling resources. So with that, I just want to thank you all for your time and appreciate the opportunity to present to you all today. And so I'll pass it over to Brad.
Thanks, George. Certainly appreciate it. I know we got a few minutes left, but I definitely want to ensure that if folks have time or have questions, that we definitely want to get those answered. So we'll go ahead and unmute everybody right now. And if you have any questions, now's the time to ask George.
George, this is Kelly Norton. Can you hear me?
I can.
I put a thing in the chat, but I had a couple of clients whose doctors weren't being very responsive. And Jarvis was great at letting me know. And so, I hopped on it and everything, but then they don't follow through and let you know that they received the information.
You know
So,
what? It's funny you bring that up because in a lot of our debriefs that actually came up, and so we have provided that feedback to the notification team, and to add that kind of follow up with you to let you know that it was completed. So,
okay,
um,
great.
so so I appreciate the call out and you sharing that. But that was kind of the sentiment that we heard across the board. So I know we're working on addressing it and trying to do a better job at keeping you all in the loop of that process.
Great. Appreciate it.
Yeah, no, absolutely.
Anybody else?
I either did a really good job or I bored you all.
One of the two. It's always a toss-up. You just never know how it goes. Now, you did a great job, George. I certainly appreciate your time.
Great
Everyone
job.
that showed
Thank
up,
you.
appreciate your time. Hey, Carrie, there you are. You have anything you'd like to add?
I do. George, first of all, thanks so much for your time. You always do a great job sharing more information than we even knew to ask you for. So thank you. A couple of things that I just wanted to point out to support what you shared today. You did share the election period booklet. And while you were sharing, I did get express permission to share that booklet in the chat. So if you haven't had a chance to download that, anyone who's on this call presently, you can hit the download from the chat and just download the PDF of the election period booklet. And the same is true of the SGRP job aid. As a reminder, that is a great resource for you as you're out in the field and trying to help people who may have needs greater than you can solve right there on the spot. UnitedHealthcare has done a great job of forming this group to help and support you, especially as you're helping the special needs community. And then one final thing that I'd like to point out is I did add a little check this out blurb on the chat that reminds you that now under fidelisagents.com, under the events tab, you are going to see a highlight of some of the really important UHC national webinars. If you're not in the habit of checking through Jarvis Knowledge Center, the national calendar of events that UnitedHealthcare puts out, you might be missing out. And we've highlighted a few of the upcoming sessions that UnitedHealthcare has graciously offered across the nation to support you. There is a national webinar that UnitedHealthcare is presenting on TRICARE for Life and working with the veterans. That is today. It's in the chat. And also you can find it on fidelisagents.com under events. And then there are two other sessions that I just wanted to highlight that are at the very end of the month. One of them is about creating your retention strategy. That webinar is actually going to transcend brand and market. If you're not already really thinking through a strong retention strategy, that's a great resource. Of course, Fidelis also has retention strategy sessions, and all of your sales directors are here to help you with that as well. Just wanted to point out a few of the added resources that Fidelis has brought to you in partnership with UnitedHealthcare. George, thank you so much for joining us, and thank you everyone for joining today's webinar. Back to you, Brad.
And one thing real quick, you all saw, the industry changes and how that kind of impacted and created a lot of consumer shopping this past AEP. So one thing I've been encouraging agents in the markets I oversee is really focus your selling around the holistic value of an organization around a carrier. So I definitely, to Carrie's point, attend some of these national trainings, and also in many markets we're doing SEP kickoffs. And those could be happening this week, next week. They might have already happened. And then we're going to be doing some educational stuff over the summer and then into the AEP kickoffs. So I would attend all of that and really focus around understanding the value proposition of UnitedHealthcare as a whole, like with programs like the social and government referrals, because that's going to help stabilize your business if you're selling on holistic value versus benefits, especially as we've seen benefits change from year to year across the industry. So just
Really do.
wanted to reiterate that.
Agreed. And again, if you all need help getting in contact with your UHC reps, you get a hold of us, get a hold of George. We'd be more than happy to help you all out. So